amigo, mi gente, bienvenido de nuevo a mi canal de YouTube. Es su belleza negra favorita, bilingüe psych MP de nuevo, con que Spanglish, lo entiendes. Me llamo Modukbeo Akinjolire. Hablo de salud mental, enfermedad y ofrezco soluciones. Si usted es nuevo aquí, bienvenido. Por favor, no olvides hacer clic en el botón de suscripción. Vamos a hablar sobre el PTSD hoy. Let's get to it, guys. Post-traumatic stress syndrome, PTSD, is a mental health condition that happens after someone has gone through a deeply scary, painful, or life-threatening situation or experiences. It could be something an individual have lived through or have seen happen to someone else, or have witnessed or have heard about, like war, abuse, serious accident, near-miss accident, losing a loved one suddenly. PTSD can result from a traumatic event that can cause flashbacks, nightmares, severe anxiety, uncontrollable thoughts, and symptoms can start after 1 month or even 3 months, depending on the severity of the event, and may not even happen or occur or appear until years later. So over time, PTSD symptoms can vary in intensity, with more severe symptoms when stress reminders of the traumatic past event occurs. It can disrupt an individual's life, including education, job opportunities, social relationships, physical health, enjoyment of everyday activities. It can also increase the risk of other mental health problems such as depression. Think of PTSD like a wound that did not heal properly. It keeps reopening even when the danger is gone. Risk factors and causes can be as a result of severe or long-lasting traumatic experiences, physical injury during the event, exposure to other traumas, being exposed to a job that is so traumatic, having drug use, lack of support, blood relatives having mental health problems. Also, it can be as a result of war, violence, those in the military, the veterans, assault, combat, exposure, robbery, being threatened with a weapon, being in the army. I feel bad when we see our veterans, thank you for your service, that comes down with PTSD. Accident, near miss accident, car crashes, fire, it can cause PTSD. Abuse in different kind, physical, emotional, verbal, sexual, name it. Childhood physical abuse, if unmanaged, can shape into adult personality traits. Sudden loss or death of loved one, a natural disaster, displacement, flood, earthquake, medical trauma, life-threatening illness or surgery. Some people develop PTSD when they have the inability to cope with that stress. They feel overwhelmed. Common causes of PTSD, I'm going to categorize them into 4 categories. Numero uno, intrusive memory. This is when you have the reliving of the experience. It keeps playing like a photograph, like flashbacks, distressing memory in the brain after the traumatic event, and it plays oftentimes over and over. It leads to nightmares, to upsetting dreams. Such an individual will not be able to sleep well. There will be unwanted thoughts about the trauma. Numero dos, avoidance. There's avoidance behavior of the people or places, activities, or conversations that surrounds or reminds that kind of person about the event. Numero tres, negative thoughts and moods, feeling numb, hopeless, disconnected, blaming oneself or others concerning the traumatic event, or losing interest in the person, losing interest or motivation in what the person used to enjoy before. Numero cuatro, 4, physical and emotional reactions, that being easily startled. You come to that person's room, the person is just easily startled, like there's increased anxiety, the person is always on the edge, very irritable, still have trouble sleeping, trouble concentrating, there's increase in anger, outburst, reckless behavior, or some can even degenerate to having self-destructive behaviors. PTSD can be treatable. We initiate the talk therapy. That is a psychotherapy. Please talk to a licensed mental health professional. The most robust, validated, evidence-based treatment is the cognitive behavioral therapy, CBT, which is very effective and very successful in helping people in retraining their thoughts, that traumatic thoughts, reframing that emotion cognition and behavior into helpful coping mechanisms that can help an individual to challenge that negative pattern to learning healthier coping strategies for stress and trauma. Also, there is the eye movement desensitization and reprocessing. Eye movement desensitization and reprocessing, we call it EMDR therapy. The use of the eyes movement to process trauma, enabling the brain to reprocess the traumatic memories in a way that lessens the emotional intensity and disruption. What EMDR does is that it unlocks the stuck trauma in the brain using bilateral stimulation, so thereby it reprocesses it to ensure that the traumatic memories are being lessened in the brain using the eye movement. Also, we have medications. First-line medications are the antidepressants, the selective serotonin reuptake inhibitors. We call them the SSRIs. It works by blocking the reuptake of the serotonin. There are two FDA-approved medications for PTSD. That is the sertraline, the Zoloft, the paroxetine. We have the Paxil. We have to note the black box warning for increase in suicidal ideation or suicidal thoughts with this kind of medication. Also, we want to watch out for side effects as well for patients taking this medication. To decrease the trauma-related nightmares, prazosin is helpful. It helps also to monitor blood pressure too. So we want to ensure that when you're taking prazosin, you are also checking your blood pressure. Easily startledness, the hyperarousal, propranolol is helpful. It's helpful also for blood pressure. So it reduces blood pressure. We want to withhold it if the blood pressure is below 150 or heart rate is below 50 beats per minute. Also, a common problem for PTSD individuals is or people having PTSD challenges is insomnia, that is loss of sleep. We want to ensure that patients practice good sleep hygiene before we go into taking trazodone, melatonin, and other sleep medications that can help with sleep. So support groups is very important. You want to share your experiences with others to help one or two individuals in having that same similar experiences. Faith and community support, spiritual healing, and trusted relationship is very powerful. Also helps in the healing of PTSD. Early treatment leads to better recovery. Espero que hayas aprendido una o dos cosas. Gracias por vernos. Hasta la próxima. Adiós por ahora. Gracias. Nos vemos. See you next time. Bye for now.